Have you heard of hyperbaric therapy?
If you want better circulation, oxygenation, or respiration,
Turn up the volume.
Everyone appreciates the increased energy and clarity.
Athletes, say goodbye to those PRs because you're going to blast
So
them.
how does it work?
We load your body with oxygen.
That means
less inflammation,
fewer allergies,
faster healing, and more.
Come see us, 1200 Executive Parkway.
You know, the Upside Down building.
Call us, 541-636-3278.
That's 541-636-3278.
We have some incredible deals.
Heal, build, and thrive
with New Leaf Hyperbarics.
Got air?
Finally, a source of raw, real, and honest information on healthcare issues that matter most. Welcome to BS Free MD. From the latest medical information to how to stay sane as a doctor or a patient, no subject is taboo, no BS is allowed. Now, let's welcome your hosts, Doctors May and Tim Hindmarsh.
Hey everybody, well, welcome back to another episode of BS Free MD, where Tim and I are still living our best lives apart. Just kidding, we are still doing I'm doing the separate vacation, and we are bringing you this podcast together. This week's episode is all about hyperbaric oxygen therapy and the combination of it with red light therapy with our guest, Dr. Zayd Ratansi, also known as Dr. Z to his patients and colleagues, who is a licensed naturopathic physician and a global authority on hyperbaric biooxidative and environmental medicine, as well as low light level and chelation therapy. He's a trainer for hyperbaric oxygen therapy, and he also is the overseeing physician of New Leaf Hyperbarics and Wellness in Eugene, which is where you see me and Tim going for our therapy and light therapy. And so Dr. Z provides concierge support for clinics and healthcare specialists who use hyperbaric therapy to integrate this into their practice. And he lectures worldwide on the use of therapy. He's advised many trainers and groups of sports and athletic clubs, from the Seattle Mariners of Major League Baseball up to even helping assist and work in treating boxing legend Muhammad Ali for his Parkinson's disease. And he's known throughout the world, given numerous lectures. So at the recommendation of Matt McCarl at New Leaf Hyperbarics and Wellness, we have Dr. Z on to dive a little deeper, as I'd like to joke, into the hyperbaric for you all to understand how it works, the different medical diagnosis, and then more on red light therapy, how to combine that with a hyperbarics and how it works. So that's today's episode. We are so grateful to have him here. And on that note, our sponsor this week is, of course, New Leaf Hyperbarics and Wellness in Eugene, Oregon, where you can go get everything from massage therapy into hyperbarics, red light therapy, and experience the benefits to your body and healing that we do. They have different price packages. You can find their information out on New Leaf. I think it's newleafeugene.org. We'll put the links up in the website. But Tim and I are always, at least I'm always raving about how much better my hip replacement recovery comes along. My pain level will go from like a 4 down to a 1 within a 1 hour session of red light therapy and hyperbarics at the same time. And so you can use it for all modalities, for everything from colitis. I know people going through cancer as well as chemo, any stages of cancer treatment, orthopedic injuries, wound healing, brain injury. Tim has used it to send patients there for COVID and long haul COVID recovery. So check them out. Again, we will put the link in the show notes, but thanks to them for sponsoring this episode.
All right, welcome back to BS Free MD. We are super excited. We have Dr. Zayd Ratansi with us, who has been really deep into the hyperbaric oxygen world as well as red light therapy. These are two things that May has found unbelievably helpful. So welcome back to both of you. It looks like May has a different background. She's still in Hawaii, but it looks like she's in some sort of Wyoming residence or something now. So
Yeah, look at, oh, I'll mess it up if I start whipping my hand around in front of this fake background. But hey, welcome to the show. Thanks for being here. We're super excited to meet you and have you on. I was going to say, so to our audience, they know how much I especially love hyperbaric oxygen therapy. And Matt McCarl has mentioned you all the time. He is the owner of New Leaf Hyperbarics and Wellness in Eugene, which I go to. And I know that you are the supervising physician for his company. And he always mentions having you on to talk about hyperbarics and do a little bit more of a deep dive into that as well as red light therapy. And so we're super excited to have you here.
Hi. Well, very nice to meet you. And yeah, I've known Matt for a while now, and we work with O2 providers, and my role is to help with the O2 providers to basically provide a means of risk assessment reports that patients can take to their own doctors and really get that connection between the patients and physicians. And so that's been a big passion of mine, to bridge that gap of education and provide research-based knowledge of hyperbaric that can be delivered both to patients to give to their doctors, and then doctors themselves to find we give access for them directly to the research. So we make it easy for that bridge.
Perfect. Well, so I know your background is in you're a naturopathic physician, and then have done extra training in hyperbaric oxygen therapy, and now run centers across the U.S. and teaching. And I know from reading that you've worked with the Seattle Mariners, and is that even helped Muhammad Ali with his Parkinson's? Is that right?
Well, back in the early days with Muhammad Ali, there was interest in neurological recovery with hyperbaric oxygen. I was one of the few people that was doing hyperbarics at that time, so I got the privilege to meet him, and I can't say enough of the positive experiences I've had in terms of some of the sports athletic teams. Yeah, we did. I did do training for the team trainers, and allowing them to understand better the application of hyperbaric and how do you integrate it within the sports and athletic world, especially with the players that have quite big time constraints. And with the hyperbaric chamber, it's not like taking a pill where I can dose my oxygen by just taking this pill. You actually have to take time, physically go in the
Hmm.
pressure vessel chamber and breathe normally. And what's happening there is you're allowing more physiologically available oxygen to dissolve into the bloodstream. And every time your heart beats, it's beating another dose of extra oxygen you wouldn't have. And that oxygen combusts with the carbon in food to create cellular energy. So what you're really doing is energizing the body through the delivery of hyperbaric oxygen therapy.
Um, yeah, a really good point. So we've sort of covered this show on hyperbarics about a year and a half ago. I can't remember what episode it was. I don't think Tim remembers either, where Matt came on and talked briefly about it. But I'm excited to dive a little bit. I love the term dive deeper. That's pretty funny. I'm not usually a very good comedian. Tim's not even laughing. But anyway,
Yeah. How many
hyperbar,
atmospheres are you going
get
to
it?
go this time?
Dive. But into the use of hyperbarics, not just for athletic injuries, but also stroke. I know people are using it for inflammatory conditions from
Mhm.
colitis, Crohn's, chemotherapy. If some questions on that, and then the adjuvant with red light. So if let's just jump in and start talking a little bit of first, how
How did you get interested in hyperbaric oxygen therapy? Any personal use of it first, or was it just something?
Yeah, good question. I was in my last year of my naturopathic degree in Seattle, Washington, and I went to a conference in my last quarter, and still trying to see what was I going to do after graduating. And I went to a medical conference and learned in a lecture on hyperbaric oxygen for wound healing. And it was fascinating. And it was fascinating, how quickly wounds can respond to the delivery of hyperbaric. And then there was discussion of other uses of hyperbaric for different types of wounds, one being neurological wounds, the brain, and brain injuries, stroke, cerebral palsy, and some of these other um, neurological conditions. So I did some research and I found there wasn't really any access for patients to get hyperbaric oxygen therapy except in hospitals. And when I finished my practice, because I was Canadian in Vancouver, British Columbia, I decided to go back and with a group of 4 or 5 other people, what we did is set up a large multi-place hyperbaric oxygen chamber for the public. And at the time, there was only about 9 um, chambers in Canada in hospitals. And really, that was about it. And so, for the first time, we had a private access for hyperbaric where patients can come and do these 1 month recovery programs. And what we found is by applying hyperbaric on a daily basis, for about 40 sessions, which is a typical doses that we use for wound healing, we found a lot of neurological benefits and wound healing in much, much greater areas than just physically what we can see. And sometimes in medicine it's you could look superficially and say, look, I see that wound healing. Well, who healed that wound? If you cut your skin, normally, your body heals, right? If it's too big of a wound, or if you don't have the nutrients to repair, and the most critical nutrient for tissue repair is oxygen. A lack of oxygen produces a deficit of cellular energy, and that's what is critically needed for tissue and collagen and for the repair process. But what we found in about 2006 was a landmark study that this surplus of oxygen actually stimulates the bone marrow to produce bone marrow derived stem cells. And actually, that study showed in 20 sessions, there was an 800% increase in mobilizing stem cells. Well, that really got us to turn our heads into a different direction as we're looking at mechanism of action and saying, boy, maybe this is one of the reasons why we are accelerating in wound healing. And what we found was the surplus of oxygen was creating new circulatory pathways to the wound, which is angiogenesis, and also the creation of brand new blood vessels from scratch called vasculogenesis, which was stem cell, bone marrow derived stem cells. So in the clinical research, you started seeing some of these what we call physiological benefits of hyperbaric, and then you look, do you think somebody just going through the aging process could benefit from new circulatory pathways, from new tissue, from regenerative a therapy based on the own body's ability to repair itself. And the research just starts pouring in on these physiological benefits of not only regeneration of tissue, but then they looked, what about the brain? Wow, we see neurogenesis. So we see the formation of brand new brain tissue, bone, liver. So there's this regenerative aspect, not only of circulatory pathways, and that's sort of the long-term benefit of hyperbaric, is you can fix or help the body um, fix an injury, but if there's a lack of blood flow, um, what's one of the best things we can do is provide that extra blood flow. And think of it like, I tend to use the example LA traffic. If city engineers knew what that was going to be like, they would have, built bigger roads right away, right? But things happen as more traffic, more population. Well, the same thing as we age, blood vessels just started getting narrow. We start getting atherosclerosis, hardening of the arteries, wounds and injuries, and just the aging process is fatty streaks start at, you know, 5 years of age, and they've even shown even before that, and the development in adolescence of um, narrowed blood vessels. Some people, they're 90% blocked, 99% blocked, others only 70% blocked. Well, if you take a look at that, that's 7 lanes out of 10, and someone's, I'm only 30%. Well, that's still 3 lanes out of 10. And so what do we do in we build new roads, right? And you go to any city and you'll see construction, new roads being built, right? But what is limiting the solution is finances and budget. So we only budget a little bit, right? And the same thing is the human body needs energy, cellular energy. So by providing this surplus of oxygen, you're providing a wealth of cellular energy. So there's no budget. And so what does the body do with this extra energy? Okay, let's start putting that into resources. And we'll see that in the production of not only new circulatory pathways, but new tissue. And then even the type 1-to-4 collagen ratio, like it's more tensile, stronger. So that's why a lot of athletes, even, older injuries, being able to repair them stronger. And so there's a lot of benefits when we're looking at dosing this surplus, and that's what I call hyperbaric oxygen, is a surplus of oxygen and physiologically available oxygen that allow for this cellular energy. Well, once you get that energy, what you'll see is within a lot of times 2 to 5 sessions, a strong anti-inflammatory response. So these pro-inflammatory cytokines, what we call, they down-regulate TNF-alpha and interleukin-1, and we start getting this anti-inflammatory throughout the body. Well, when you have injuries, you have inflammation. Even with brain injuries, you have something called neuroinflammation, inflammation in the brain. And so, then you start thinking, can this delivery of hyperbaric help just in people with inflammatory disorders, inflammatory conditions? We start looking at the influence then of hyperbaric to be able to help the body recover from conditions that are inflammatory based. And what's a very popular medication that we use? Inflammatory drugs,
Right.
non-steroidal anti-inflammatory drugs, NSAIDs, Celebrex, diclofenac, aspirin, all of these medications to reduce inflammation. Well, then when we reduce inflammation, what can happen? people who might have pain disorders that are inflammatory based. That starts remodeling as well. So now you look at the application of how many people are on pain medications, but not opioids, because they switch over to the NSAIDs, the non-steroidal anti-inflammatory drugs, and get benefit. Well, why not provide a natural anti-inflammatory support throughout the body called hyperbaric oxygen therapy? So by delivering that, and a lot of times within 10 sessions, we look at the pain model being influenced in a positive way. Well, then you can go further with a surplus of oxygen, and we start looking at the protection of the cells. And when I say protection, we're talking about antioxidant protection. And people look at me and they say, "What are you talking about?" When you're giving extra oxygen, you're creating oxygen stress, and you need to take antioxidants. Well, that's not necessarily true. Your every cell is lined in the inside with cellular we call them endogenous antioxidant. We have our own. Every cell has its own antioxidant system within the cells. Superoxide dismutase, glutathione peroxidase, catalase. These are all endogenous antioxidants that help protect, because when you're combusting, you're creating those reactive oxygen species, right? Combustion, just like you turn the car engine, right? And so when you have combustion, you're going to create exhaust, and the DNA is so fragile. That's why every cell has to have just all these sequential antioxidants. So really, by oxygenation, you're creating a metabolic stress, and within 24 hours of one sessions, you upregulate antioxidant. So rather than taking antioxidant pills, we should be supporting the antioxidant system within the cellular terrain. Well, that makes us stronger to protection from future anything. And then that leads us to the studies that started coming out on preconditioning. And we started looking at preconditioning and doing hyperbaric as a preventative because of this strong protective role, that we never know when we're going to get injured, or be in a toxic environment from exhaust or paints or anything. But the more protection yourself, the more natural antioxidant support you have, the better your body is to handle the day-to-day stresses that we're living with. So maybe I went a little on the explanation there. Maybe I'll just keep going for just one or two more, because I should then talk that, as we say, oxygen, energy, the one organ that utilizes oxygen for some other key roles is the immune system. The immune system takes in this extra oxygen and creates these like oxygen radicals, bleach and peroxide, and that's how it kills invading organisms. So think about it. That's how your immune system attacks invading organisms through these oxygen-derived vacuoles, and they call phagocytosis and apoptosis, and we're and helping to kill, because they don't have these endogenous antioxidant protection. So even if you throw it all out and your good cells are around all these vacuoles, they're protected by that. And even cancer cells, they can't upregulate this. Remember when I said 24 hours later, after one session inside the cells, you have more protection because you have more oxygenation, more combustion, and you get that, right? So first session, yeah, it's stress, but then there's adaptation. Cancer cells don't have that adaptation. So they're more prone. That's why some of these therapies are oxidative radiation therapy, chemotherapy, right? And so providing oxygen, then what was found was chemosensitization, radiosensitization. For radiation therapy to work, you need to have the radiation splice the oxygen. Well, the more oxygen, the more you can have these free radicals that the cancer cells cannot protect from. So part of the therapeutic delivery can be as a joint strategy to add hyperbaric within cancer treatment. I heard so. There are a couple of things I heard you say: inflammatory disorders and immune system. So I thought I'd just bring that
No, that's
together.
great. A couple things come to mind when I listen to this because we've done it. May's done it way more than me, and she's had a lot of success. And I'm sitting there. We're going to move. At least the plan is we're going to move in the next 5 or 6 months. And I'm like, well, maybe I'll just get one of these instead of a hot tub. And so first off, is there a maximal dose? Is there an overdose that
Yeah.
lots of things in healthcare are thresholds, right? Like even exercise, you can only exercise so much before you start to tear things down too much. The reason you exercise is to stress your body. How your body gets better is through rest. It's the rest
Exactly.
after exercise that actually makes your
Excellent.
muscles bigger and your heart fitter, etc. So is there a dose not a
Yeah.
dose response curve, but is there a maximal dose where it's like,
Yeah.
okay, now
Yeah.
you got too much oxygen?
Well, and there is. So there are some. So there's three variables to your dosage. One is the pressure. How much pressure are you going in the chamber? The more the pressure, the greater the dose. Number two is how much time are you going to spend? 30 minutes, 90 minutes, 2 hours. The greater the time, the greater the dose. The third is what is your breathing apparatus? You can do a cannula, face mask, an oxygen hood, or be in a pure oxygen pressurized chamber. The more oxygen delivered to the alveoli, the greater the dose. Okay, so there is a something called oxygen toxicity, and typically that is when you're doing a combination of those three variables and all being high. Um, time is a big thing. The best way to deliver hyperbaric is to go slow and go lower in the dosage and time. I tend to look at about 60 to 90 minutes in a hyperbaric chamber, sometimes even 30 minutes as your time dose, right? And that provides a very for most pressures, I'll do under 2 atmospheres. So that's about 33 feet below seawater pressure. What hyperbaric, just so if for some of the viewers that don't know, hyperbaric is hyperbaric above and beyond atmospheric pressure. So if we're at sea level, atmosphere, the more pressure, so it's like going down under seawater. So if you go higher in the high elevations in mountains, um, the air is thin per se,
Thinner.
and you're getting less oxygen, right? That's up in the mountains, right? But when you're going down under pressure, you're getting more oxygen. That's through these gas pressure laws of physics, and so the dosage that I'll always use is typically under 2 atmospheres or below. It's a very, very safe dosage, and then minimal risks. The lower you go, the more you're reducing any type of risk. It is a class 2 medical device, which means that you can get your doctor involved as well, and that's where we come in to help educate the physicians who know their patients better. But generally speaking, if you keep it to short bouts and the lower pressure, you're pretty much at a high safety um, feature there.
So how much
So that's
pressure?
I was gonna
How much
say
pressure do the wound healing people use? Because I know
Wound-
these hyperbaric wound healing
Yeah.
clinics are like gigantic money presses for healthcare systems.
Yeah, it's wound
And
healing. We'll use, if we're looking at like diabetic wounds or
right,
really hard to heal wounds. We'll be looking at 2 atmospheres, right to 2.5, 2.5, which is about let's say 33 to 45 feet. So and that's why I've always stayed at 33 feet at 2 atmospheres of pressure, because it provides the for what I've seen, good outcome measures, but the lowest risk, potential risk of getting too much oxygen, which is what your earlier question
right.
that started this is. So you want to get the we call it a benefit to risk ratio, and there's many ways that we can reduce the accumulation of oxygen if we were at a higher risk. And one is just by taking the mask off for 5 minutes. And so that's commonly done as well. If let's say somebody is in a little higher risk in our screening process, then we'll recommend doing these 5-minute air breaks, which then cut the toxicity right back down close to the baseline. So, there's a lot that we have in our educational resources to help personalize dosages.
But what I guess to Tim's point is what you're using, or when I go into the hyperbaric chamber at one of these outpatient centers, it's not the same amount of pressure as in a
Yeah,
hospital setting, correct?
Yeah. So the portable chambers, they're called soft chambers. They go to 1.3 atmospheres, and that's only like about 9-10 feet below sea level. So you're at a much lower pressure, and it has an impeccable safety record, which is great. And it provides a significant dosage of extra oxygen. And like I said, we tend to, like, they're called lower pressure or mild hyperbaric, but it's a significant dose. And I try to get people to really understand that every time when you're in there, every time your heart beats, every time you breathe 14 times a minute or whatever, you're just getting more oxygen into the bloodstream, and the heart doses it just like you're taking a dose of medication, and that's extra that you wouldn't have. So you think 60 beats per minute, that's 60 dosages of extra that doesn't get wasted, right?
Right.
So as you're in these chambers, and lower pressure protocols, 1.3 to 1.5 are great protocols that maximize that benefit to risk ratio, right? And even a study that came out, which was published in the UHMS, they looked at the anti-inflammatory mechanism, and they found that 1.5 had a stronger anti-inflammatory than 2.4, than our what we use in the deeper hospital or wound care based chambers. So more dosage does not mean better outcome. And for some
Interesting.
conditions, yes, we do want, like someone has carbon monoxide poisoning, or, there are times that I will recommend right up to 3 atmospheres. But it's not often I'll go into the 2.5, 2.4. One is called the Marks protocol, which is a standard protocol for oromaxillary surgeons of post-radiation damage. So after radiation of head and neck cancers, we can get something called osteonecrosis. And so if there's dental work that needs to be done before the dental procedure, we'll recommend about 20 to 30 sessions of hyperbaric oxygen at a dose about 2.4 atmospheres, followed by 10 sessions after the procedure. And that's just a standard medical treatment-based dosage. But I don't look at hyperbaric as a treatment most of the times because there's so few conditions that are quote unquote FDA cleared and indicated for that. I'll look at hyperbaric as just supportive for the body, like an oxygen supplement. And you're going in and you're just getting more oxygen to help for general health and wellness for your body. And playing off those physiological benefits of extra oxygen in a very safe dosage to provide cellular energy, maybe not to go for a run, but to help your body repair, regenerate, and overall functioning of tissue.
So I want to talk a little bit about outpatient therapy, as I've been doing in one of those low pressure chambers. If someone's to go in and use it for, I've been using mine for orthopedic and tissue wound healing, or even, and it's probably going to vary, or say someone's going through a bout of colitis or chemotherapy. How do you, and what do you do as far as recommending how many sessions per week? I know you can vary from 30 to 90 minutes. How do you dose it out?
Put it this way, a standard dosage of hyperbaric, just like if I was going to give a course of antibiotics, there's some, the limitations with hyperbaric is, like I said, time. And so, it's easy for me to get someone to take 2 a day and finish this bottle in a month. I could just, easy for a medication. So, typically a standard dosage of hyperbaric, a typical course of hyperbaric is 40 sessions. And that helps. For me, what I've seen is the strongest support for those physiological benefits of reducing hypoxia, of oxygen debt, and that stem cell mobilization, for those physiological benefits that then might lead to outcome measures. But I'm only looking at supporting the body. And a standard dose of 40 sessions is something that I can't say enough of and that's really my start. That's when I said I started my practice, that 1 month hyperbaric program that people came in because there was no chambers access for them. So there's about 5 hotels that contracted 1 month stays where patients would just book a month in the hotel and come every day. I later changed it to 5 days a week because we found that 2 days of rest was very important, just like your comment on the exercise and rest. And 5 days on, 2 days off, and these little bouts of, and that's why it's called intermittent hyperbaric oxygen therapy. And you go through these what we call hyperoxia, and then when you come out, you're going into a little transient hypoxia per se, but then there's hypoxia, and you get this these adaptations from both low and high oxygen stress markers. And so that is the main reason why we dose hyperbaric daily. And for me, I've seen, better outcome in dosing twice a day with a 4-hour break. And so a lot of times that's just a standard dosage if people can afford the time and the finance to be able to do that. That's the most common recommendation. because again, it's not FDA used for treating any of these conditions. So what do we want? We want the benefits of the support and supporting the body to treat itself. So a treat for the body as opposed to treating the body. And really that's what you're looking at is support. And what's the thing that adds to that is what you said, rest earlier. And that rest, and now you're resting on high oxygen. When you come out of the chamber, your heart is still pumping high, rich plasma oxygen, like a buffet is going around. So
Right.
tissue that that need more, they can just take in more, right? But eventually, after half an hour, that blood, that extra surplus starts going back down, and then it's just normal, right? So during that time, rest is very important. And that's when I'll do targeted light therapy, because now in the chamber, I can't tell the oxygen will just go to the brain or go to the wrist or go to that wound. But with light therapy, you can target and direct that blood flow right to that area. And so we'll do a lot of light therapy alongside hyperbaric. We call it targeted hyperbaric oxygen therapy.
Right. So actually, to my point, is that I've been using a lot of that when I'm in the chamber at the same time, because I find that without that, the effect isn't the same. And so I'm hearing you say that 40 sessions is ideal, but you still can do a shorter course of therapy, because I
Yeah.
noticed a huge difference. Obviously, 40 would be ideal for whatever condition you have going on. But then when you add the targeted light therapy, that's when I really noticed the massive difference. I mean,
Yes.
I've had a hip replacement in January. I've been using it for that. I will have a bad day when it's stiff, painful. I'm kind of almost limping when I get into the chamber, pains 4 out of 10. And then I put the light therapy pad on there with the hyperbarics and come out, and like I'm almost at like a 1. I can tell instantly
Excellent.
it's relieved. So that's me, maybe not everybody, but let's talk about the red light therapy and how that works. I mean, there's everything from targeted pads to a full light bed, like a tanning bed.
Yeah.
So how does the red light therapy work to get that oxygen in? You can use red light therapy pads without oxygen. So why don't we
Yeah.
just talk about how that works?
Yeah. So excellent. So light therapy, it is a strong and a very powerful localized effect. And when you put so we use these light pads, and they have diodes that push down on the skin. So now it pushes the skin, and we can dose that light right to whatever area. And what's going to happen is a transfer of energy. Energy can't be created or destroyed, so you're transferring photon, light energy, and actually into cellular energy. So red light will absorb in chromophores. One of the chromophores is called cytochrome C oxidase, which is the in the mitochondria in this where we generate this cellular energy, what we call ATP. What's happening is oxygen and cytochrome C oxidase. That's where all the action happens, and all of a sudden, all this hydrogen goes out, and this proton pump comes right back in, and then packaged ATP and energy is transformed. So we're actually very similar to where oxygen generates this cellular energy through light, and because light then excites the with that cytochrome C oxidase, and hydrogen comes out back in, and we just start getting this cellular energy, fibroblasts, collagen, tissue. And then what's happening is there's also a near infrared light that's used, and that creates just a very short term opening of blood flow, just this massive short-term dilation. Just like if it's rush hour traffic and then all of a sudden you get 4 extra lanes for that 3 hours, or it's the same thing, but it's not 3 hours. It's very quick. And what's happening is it's a strong localized energy, and then you let go, and there's this reactive oxygen species that are created, but then there's a strong anti-inflammatory. So the two things are blood flow and anti-inflammatory. And actually the FDA clearance for the light is for blood flow, inflammation, and pain. So anytime, but so very similar to hyperbaric, we're trying to help the body in repairing and function and regeneration. We can use light therapy directly to just powerhouse a lot of action and energy, especially the pain inflammatory model. And the good news about light therapy is its protocol is not daily. It can be. If you have a light system, you could do it every day, no problem. But with light, you can see one session and a week later even the benefits. So
Right.
now you can use the light therapy protocol with hyperbaric and say, well, let's do it once a week or twice a week, or some people even once a month. But you can see a cellular effect and then adaptation to that. And actually, light therapy went head to head with Celebrex, diclofenac, and one study with your non-steroidal anti-inflammatory drugs, and there was no difference in outcome for pain. And I think these were arthritis sufferers, elderly. But when you're taking these steroids, what's the major downfall of it? Kidney failure, GI bleeding, side effects. So
Right.
in light therapy, not side effects, side benefits, plus it's localized. Wow, pain, my wrist is better. But it's actually helping for that final repair, as opposed to just knocking off the pain receptors and saying, "I don't feel it."
Right.
And
So
and so
can you speak to the different wavelengths? So I know that there's different, and these light devices have different wavelengths of light that target different things. Some deep therapies better for reaching deep into the bone, others are
yeah.
superficial for wound healing, others cycle for regenerative purposes. And so um how, I guess my question is, if it's just helping with at the cellular level, then is the difference just how deep it penetrates through the tissues?
It is. It is, and it's
Okay.
not linear. Like the higher the wavelength, the deeper it is, because as you get other beneath the skin, there's a whole array of stuff, including liquid and water, and they absorb at the higher wavelengths. So you might not get as deep if you go linear in that. So we have therapeutic wavelengths that we'll use that are research based, and they'll start in blue light, and you can blue light is more superficial, and so those are wavelengths, let's say 480 nanometers, 460. I use 485 a lot, and that is if you close your eyes and you there's an eye mask. Um, what you'll get is almost that representation of being out in the beach or in the sun. The that that transference of light
Hmm.
therapy. Um, Studies have shown for mood, circadian rhythm, first thing in the morning, really affecting in 30 days your sleep cycle. They did studies in elderly homes for balance and walking after just 1 month of daily light therapy on that. Then you get higher, green can be used about 500 nanometers, wound healing, but tissue healing, I'll use a lot of red, which is 600, and you'll see dosage of 635, 650, 660. Those are very common. Deeper red, about 700 nanometers. We can use that as well. And then when you get the infrared, you can't see it, your eyes, but those dosages 810. 810 has been found for tissue healing and also neurocognitive. So there's a frontal lobe one for the brain for cognitive and brain injuries, brain repair. That's a common one. 830, 850, and 880 are also
So,
common wavelengths.
what are the timing on this? Because I know that when I'm using them in the chamber, usually they are set for, I think it's 20 or 30
Correct.
minutes, and then
Yeah.
they go off. So anything beyond that,
No,
even though I'm still in the chamber for 60 or 90
no,
minutes, you can't use it any longer. And
yeah.
why is that?
Well, don't, because you have all that, you're putting a stress and then you're
Hmm.
getting rid of it, and you want that adaptation. Very similar to what you said earlier. You mentioned the example about the exercise, and you go damage your tissue and then you rest and you rebuild, right?
Okay.
And so you want to and it's just these light pads are very high dosed locally, so you only need that short period of time. There's something called a biphasic dose response of light. It's a bell curve, and the longer you leave it, actually it's an inhibitory effect. So why would you want to
Right.
leave
Interesting.
it?
So what's
You
the time in between that you need to rest? Is it
about
24 hours?
you need at least 4 hours if you're going to reapply
Okay.
to the area.
Okay.
But that's why you can do it you can do light therapy over an area every 2 to 3 days, right up to every week or two. Now, if you have some people have home units, they could do it every day. They love it, you know. But again, you don't want to leave it too long. I don't mind over the brain, the forehead. We typically do 30 minutes, and you could do 40 minutes if you want, like double it, because it does take you're losing dosage through the skull. So it's a lower dosage. And you know what? It's the jury's still out on there. 20 minutes you're safe with. You're not
Right.
uh,
I was about to ask, so there's a lot of people that I know that have different home light therapy pads that they buy online from Amazon to other reputable companies. And
yeah,
so these come with instructions, obviously, to tell them, hey, you need to give a rest period in between so that you don't get the inhibitory response. So it basically, um, they know they're not overdosing on these pads.
Yeah, so that brings up a point though, because it's pretty easy to get little red LEDs and sell it and say it does something. So
Hmm.
like I see this being,
yeah,
wide open to, like these kind of scammer
yes,
things, because May's looked at she loves it so much. We'll probably end up getting a home unit, and they're not inexpensive by any means if it's truly the correct wavelength of light with the correct kind of diodes that do it. But yet you can buy all sorts of cheap stuff that's,
you you
$50, and does
you
it do anything is the
you
question.
pay what you get for. And you know it- the lights that we use are class 2 medical devices as well, but they're regulated with dosages, so we get them checked, and we use very specific diodes that will give the dosage that we want to get these benefits. There's no point in doing something just to do it, right? And some might feel good because it might give a little heat, yeah, which is not the primary mechanism of action, uh, um, you know, on that. So, it's um,
I have a
I,
question.
yeah.
Just thinking about when you talked about the diodes being on the skin, does it need to be on there tight? Because sometimes I'll have something like an elbow pad on, and it's
Yeah.
not super tight just because of anatomically it's hard to get on there. I've just had a recent bone procedure. It
Yeah.
hurts. So I lay it on there. So does that
The
also
closer,
vary?
there's an inverse law of like you're losing 50% every inch or a
So
doubling.
yes, you want it flush to the skin if you can.
The closer to the skin, the better we can dose.
Got
And
it.
so when we train on light therapy, and typically we started off with lasers, we got to push and hold and then move it, and so we advanced from that into very simple application of pads that have Velcro that go nice and tight, and then we put little diodes so they can push the skin down and trying to get the best application of that. The thing that is really challenging is when you see people putting light over clothing, which I you know what? You are not going to be dosing anything if you put it over clothing. It has to be directly over the skin. And this is important for those. And so you'll always know if the company is a real company if you see that um, or if it's a scam or whatever, if you see that they're putting it over clothing and stuff because they probably haven't gone into a proper light
Right.
dosing in that.
So why don't you can you recommend to our listeners what company you'd recommend for purchasing light therapy pads? I think I know what it is, but at
Yeah,
least I know what they
we're
recommend.
yeah, we're exclusively with LS Pro systems, so LS Light Systems, Pro Systems, so LS Pro Systems. And but you know what? There's lots. We want people to really get into the light, understand the benefits of the light, and so that's just one that we've done a lot of work with that we're always advancing. Right now, there's new silicone only pads. There's a transcranial pad that goes right over the frontal lobe, and that has 810 and 880. And that's dosed at over 80 milliwatts per centimeter squared. So we test all of that.
And so what would be the benefit then of going into a full bed versus a targeted light pad? Because to me, I'm thinking targeted light pad is better because a different
Yeah,
part of the body has different
yeah,
needs. What does
yeah.
the full bed
A
do?
full light, you're just energizing your whole body. And so I love doing that when you get out of the hyperbaric chamber, close your eyes and just get into that light bed. And so the light bed is one that you can just um, put your whole body in there. Again,
Like a tanning bed, right?
yeah, again, the closer you are, uh, the um, the higher the dose, and so with the beds with the LS Pro systems, they're shooting out at 140 milliwatts per centimeter
Okay.
squared, and have a cooling system to maintain that because a lot of times when you turn it on, then within 5, 10, 15, 20 minutes, the dosage goes down with the heat.
Oh.
So
So what you
maybe
need to do is because we talked about this at the chamber is you need to
yeah,
get a bed that fits in a chamber so you can do the full
yeah,
bed instead of all these pads stuck to
yeah.
different parts of the body with all these
They both,
wires going to
yeah, like you said, they both have different effects.
Mhm.
Pads, I want to target one area, and then I'm going to do the pads. So I use the pads a lot. The beds are a luxury to have. Just go in, and again, you got to be fully no clothes, and you just go in, and just the whole body is energized with light therapy.
Perfect.
Wow.
Well,
Yeah, I'm surprised.
start
I'm
saving
waiting
up
for
then.
somebody to come up with a red light condom. I'm sure
Oh
that's
my
going to be the next
God.
treatment. Because
Well,
it seems like on
yeah,
Facebook there's like 19 gazillion different ads for some new novel,
yeah,
sex
Well,
treatment therapy
yeah.
stuff. So
those
Both
those
hyperbaric.
pads have Velcro on them.
yeah,
Yeah, there you go. Both, yeah, they do have small, medium, and large pads. So, but
exactly.
No
but
comment.
yeah, you do, but both hyperbaric and light therapy have, hyperbaric has even imaging studies done on the 40-hour protocol for erectile dysfunction for men. Also, obviously, can help with females, and then the light therapy as well, blood flow. So you're both applications actually can really help people for sexual dysfunction.
Yeah, and it's not
Interesting.
pills, which is a big deal. We know that you're probably bumping up against the time limiter here. So why don't you tell our listeners where they can find you
Or not find you.
or
Maybe
not
he's
find
like,
you?
no, they don't.
Yeah,
Yeah.
I was going to say, I don't practice at this time. I do have a website that does have information, and if people do want more information or even hyperbaric training, it's an online educational resource. I have lots of resources on my website called drzayd.com, and it's just dr and my first name zayd.com. Dr. I think that is it.
Yeah.
Oh, well, I'll double check and I'll put the link in our show notes for sure. Don't worry. If you forgot, we'll find it out for you.
Yeah. I didn't do it, but it's been there. It's drza.com, I'm pretty sure. And that's just a educational resource. And then if they did want any personalized support, we can help there as well. And yeah, just really understanding how to apply hyperbaric oxygen and light therapy within your community. If it's a center, a gym, a spa, any type of available access, or if it's just for personal home use, which we're finding more people wanting to get hyperbaric oxygen and light therapy for home use. And the website for the lights are lsprosystems.com, and you could probably post that as well. But everything is
Yes,
on the website.
perfect.
Outstanding. Yeah, outstanding. Because I know even in the reading I've been doing in our COVID groups, Peter McCullough started the C19 group and then the C21 group, which is a Google group. Lots of emerging evidence for long COVID with hyperbarics, which is really exciting because, again, low side effects, high margin of safety, and anything we can do to help these people that have been, suffering with
Yeah.
the long
Well,
since.
we got really good data, and it's we're finding only 8 to 12 sessions, not much in hyperbaric for that. And so one website that is a really good resource. It's a link from my Dr. Zayd. It's called Hyperbaric Experts, experts.com, and there's a latest research page. And what I do is I'll post the latest studies, write it for the layperson, and then there's a link for the physician, the hospital, the doctor, so they could see the full study. And then I'll categorize them by aging, cancer, diabetes, COVID, and so that makes it, again, my role right now is education, bridging the gap between physicians and patients, and then how to integrate that within day-to-day activities or within their specialty. So if it's like I said, a gym, how do you utilize these within that arena or in exercise performing? We haven't even talked about preconditioning the tissue and what we've used for light therapy for athletes where you can actually precondition that tissue and then go out, do more reps, less fatigue, and quicker recovery. And that's through the targeted paths. But that's why even that whole light bed is commonly used by athletes for that.
Interesting.
Oh, that's great. Well, that will be when we have you back, because this has been a lot of fun. I know our listeners are going to be really interested in this.
Yeah, for sure.
And again, very, very it's fascinating, because we've done several episodes now on carnivore / keto diets, and that all centers around cellular metabolism, mitochondrial energy, and that's exactly what hyperbarics are doing. I mean, the mitochondria.
Yeah, we have a lot of studies on pulsing that as well, and adding hyperbaric during ketosis. We use that for cancer. There's cancer studies, glioblastomas, brain tumors, and you're working off of adaptation, and the human body is just brilliant at doing that. And that oxygen stress, the keto stress, really are where the body shines on its adaptation. And when you combine the two, you'll have some really good synergistic effects. So you'll see that a lot: ketogenic ketosis and hyperbaric oxygen.
Outstanding. Well, on that, we shall leave you. You have a lot to do today. Enjoy your trip to Oregon. I hope it is productive for you. And we will definitely be in touch, and we'll get all those links to all this good stuff in our show notes, so that people can continue their own education. And we would highly encourage, if we're middle-aging athletes, and I cannot speak highly enough of how I walk out of there and I swear I have 3-dimensional vision. It like completely alters. Like all the colors are different, and I'm like, did they put some sort of like psilocybin in the oxygen?
Yeah.
It's really,
you just got oxygen
really
toxicity. There you go. No, I'm kidding.
No, but it's an essential nutrient for life. Just think, don't breathe for 5 minutes and tell me how much energy you have.
Yeah, exactly.
Our bodies are oxygen dependent, but we're actually energy dependent. Not even doing anything. We have sodium, potassium pumps going on. There's all this stuff, activity that we don't even think about, that we need energy and cellular energy for. And oxygen, that's why you constantly need a new supply of more oxygen, and we use it constantly. So just getting a little more, and getting a little more dosed in a local area with the light, huge effects for our body. So thank you for all the support and the education that you do to the communities. And any other questions, I'd be more than happy to help answer.
Thank you so much.
Thank you so much. Nice meeting you, and thanks for your time again.
All right, take care.
Wow. So again, this is, it's interesting, because it's not one thing that does everything. It's not just diet. It's not just exercise. It's fascinating. And this whole idea of, what did he say? It's not treating the body, it's a treat for the body. I thought was a super great line, because it really is. Like an hour in there, and you immediately notice the difference. Now, are you going to notice it the same as if you go for 40 sessions? Of course not.
I notice a difference, like I said at the beginning, in just the 60-minute session with the red light therapy pad on there. It's not quite the same without the red light therapy pad, and I notice a difference. So cumulative is better. And just like anything else we put in our body, you wouldn't take one amoxicillin and expect your infection to get better. You need the whole course of therapy. But having said that, 40 sessions is not cheap. These sessions, depending on how much you pay, they vary. You can get them on sale for $75 for an hour therapy, up to $125. And so that adds up. And that's why we see a lot of friends, clients, patients buying their own chamber when they have these debilitating conditions and they know they're going to need a lot. But you can see benefit even in one session. And so to his point, more is better, but don't be discouraged if you're like, I don't know if I can afford 40 sessions. Forget that. It all helps. So yeah, absolutely. I would run, walk, scream, McCarl to Hyperbaric Chamber because I love it. It's done wonders for me. What were we going to say, man?
So just another tool in the toolkit of things that aren't pharmaceuticals. The red light I thought was complete nonsense until you actually see how it works. And I mean, it really is quite mind blowing. And again, there's a quality issue. You need actual real red light therapy, not just
right. Well, we know how blue light therapy works. We know
how it works for mood. Yes,
yeah,
definitely.
Why not all of the wavelengths across the spectrum have some impact in your health for sure? So
all right. And
we will put links to those as well in the show notes so that you can find where to get reputable light pads. LS Pro is one of those companies, and look up your local outpatient hyperbaric chamber for the one closest to you. That's all I can suggest. And if you live in our neck of the woods in the Willamette Valley of Oregon, we recommend New Leaf Hyperbarics Wellness in Eugene, Oregon. They're our sponsor of this show today, and they're a regular sponsor of us monthly. And you will see me posting on our stories, especially Facebook and Instagram stories of me in the chamber, getting my groove on when I'm in there, healing up my multiple, I don't know, I think I'm an athlete. I'm an ex-athlete now, but it certainly helps. So.
All right. So check them out. Check out the links, and we'll see you all again next week for another amazing episode.
See you next time.
It's no secret that medicine is a bit uptight. That's why Tim and I created BS Free MD, to mix things up a little and have fun in the process. Besides, we are having these exact same discussions all the time, so we thought we might as well invite everyone to the party. If you really like us, you can get plenty more and maybe see one of Tim's cool tattoos on our Instagram or Facebook pages at BS Free MD. See you next time.
While we try to keep BS Free MD as raw and real as possible, we can't be held responsible for any medical decisions or discussions had as a result of what you've heard on the show. We know, bummer. But the truth is, we really do care about your questions. So feel free to reach out to us by email at doc@bsfreemd.com.